Mixing McLean, I'm going to be doing an HEENT assessment on you. That just includes your head, your eyes, your ears, your nose, and your throat. And I'll also be taking a look at your skin and nails. So first, I'm just going to start by just taking a general look at you. Your skin is appropriate for your race. No scars, no lesions. I see you do have quite a bit of tattoos. Do you practice safe needle practices when getting tattoos?
Yes.
Okay. And I'm just gonna take a look at your hands. Nails are intact to nail bed. They're smooth, they're round. Cuticles are intact, no peeling, no redness, no swelling, no scabs. I'm just gonna press down. Capillary refill is less than 2 seconds. Skin is smooth, warm. Okay. And I'm just gonna take a look at your head. Your hair is appropriately distributed equally to your eyebrows and beard. Also distributed equally to your head. No scabs, scars, or lesions visualized. I'm just gonna take a feel. Okay. And I'm going to feel your sinuses. Do you have any sinus pains or pressures?
No.
Okay, so I'm gonna feel your temporal and then your maxillary. Okay, and then I'm just gonna assess your TMJ. Can you open and close for me? Okay. No popping or crepitus felt. Jaw also did not lock. So now I'm just gonna take a look at your eyes. Sclera is white. Patient's eyes are brown. Eyelashes are evenly distributed. I'm gonna have you look up to the ceiling. And I'm gonna just pull your eye down some. Conjunctiva is pink. No redness, no drainage, no swelling. Orbital is smooth and no puffiness. Okay, so now I'm just gonna assess your vision. I'm gonna have you read the lowest line on this chart, standing 6 feet back. If you could just read the lowest line for me.
LTF PH.
Okay. And then I am just gonna take a look into your eyes with my light. I'm gonna have you look straight ahead. I'm gonna shine a light. Okay, pupil constricts. Pupil constricts. Okay. And I'm just gonna measure. Pupil is 3 millimeters. Equal, round, and reactive. So next, I'm just gonna move on to the fundoscopic portion, and I'm gonna take a look into your eyes with my ophthalmoscope. I am gonna get a little close to you, but I'm gonna put my hand on your forehead, and I'm gonna lean in with the scope just so I can visualize. I'll make sure you don't have any abnormalities.
Okay.
All right, so I'm gonna have you look straight ahead, and with my dial set to 0, turn my light on, and it's gonna lean in, and attach the red reflex. I can see arteries, veins, and macule. Okay. Just gonna take a look into this eye over here. I'm gonna get a little close to you, okay?
Okay.
Past the red reflex, the arteries, the veins, and the macule. Good. I eyes look good. Turn that off. And then now I'm just gonna test your peripheral vision. So I'm gonna come in close to you and I'm gonna move my fingers and I just want you to tell me when you can see them moving, okay? Look straight ahead.
Okay.
You ready?
Yeah. I see him. I see him. I see him.
Okay. And then I'm just gonna have you follow my finger to your nose.
Okay.
Okay. And then I am going to have you follow my finger. And I'm gonna test your cranial nerves. So that completes the eye portion. Now I am going to move on to your ears. So first I'm just gonna take a look.
Sorry about that.
I'm sorry. And ears are symmetrical, no deformities. Just gonna take a feel. Any pain?
No.
Okay. And feel back here. Mastoid process. Okay. So now I'm just gonna take my light. And I'm gonna take a look into your ear, okay?
Okay.
Alrighty. And I'm gonna pull the ear up and back to better visualize the ear canal. It's nice and pink. And see the tympanic membrane is nice and gray. See the light of lens in the Okay. Alright, I'm gonna take a look into this side of the ear. Alrighty. Up and back so I can get a better visual of the ear canal. I can see tympanic membrane. It's nice and gray. Okay, no foreign bodies. Okay.
Here you go.
Alrighty, so this next portion, I'm just gonna test your hearing.
Okay.
So I'm going to start with the whisper test. So I'm just gonna occlude this ear and I'm gonna whisper a phrase, well, a word, and I want you to repeat it back to me.
Okay.
You ready?
Yes.
Okay.
And here. Facebook. Facebook.
Okay. Move around to the other ear. I'm gonna occlude this ear and I'm gonna whisper a phrase. You ready?
Yes. Baseball.
Okay. And next, I'm just gonna do a Weber's and a Rhymes test. I'm gonna sit this on the top of your head,
Okay.
and you're gonna hear a vibration. You ready?
Yes.
Can you hear that in one ear more than the other? Or is it about the same?
It's about the same.
Okay. Then do the Rhymes test. And I'm gonna put on your mastery process. Let me know when you don't hear it anymore.
I don't hear it anymore.
Can you still hear it?
No. Yes.
Okay. And I'll test this ear. You ready?
Yes.
Okay. And I'll put it on your mastery process. Let me know when you don't hear it anymore.
I don't hear it anymore.
Can you still hear it?
Yes.
Okay. So air conduction is greater than bone conduction, which is great. So now I am just going to I am going to move on to your mouth.
Okay.
Well, actually, I'll do your nose first. So I am just going, nose is symmetrical. Put a tip on here. And I'm just gonna shine a light, look up in your nose. No scars, no lesions. Tissue is pink. On this side. No scars, no lesions. Is it tickle? Tissue is pink. Okay. No drainage was visualized. So now I am going to move on to your mouth. So I am going to just have you, first I'm just gonna have you open. Just gonna take a look, get my pen light. No lesions, no sores, no scars, nice pink moist tissue. Have you stick your tongue out? Yeah. Okay, uvula's pink. No redness, no swelling. And then I am just going to put some gloves on. And I'm gonna palpate in your mouth. Alright, I'm gonna have you open up. And hey, put your tongue down. Stick your tongue up. Say ah. Very good. Okay, I'm just gonna feel. Okay, no lesions, no sores, no ulcers. Skin is nice and moist and intact. Okay. So now I'm just gonna take a look at your throat. I'm gonna have you turn your neck. I'm gonna have you turn your head to the left and to the right. Okay. And I am just gonna start. I'm gonna palpate your trachea. It is midline. No bruise felt. Okay. So now I am just I'm gonna feel your lymph nodes.
Okay.
And I'm just gonna make sure there's no swelling, no tenderness, anything of that nature.
Okay.
So I'm gonna start with your occipital, do your post-auricle, do your pre-auricle, your submandibular, your submental, cervical, post-cervical, and your subclavicle. Okay. And then I'm just gonna feel your neck again. Then I am just going to assess your thyroid. Gonna assess your thyroid. I'm gonna take a feel. And I'm gonna have you swallow for me. Okay, I feel the hyoid bone move. Do one more swallow. Okay. So, no, everything felt normal.
Yes.
Any tenderness or anything with anything?
No.
Alrighty. Well, that completes my exam. Is there any concerns that you have?
No.